Good morning, everyone. Thanks, Dr. Blank, for inviting me to participate. I really enjoy events like this because I love hearing really from you. So this is, I hope to be a little bit of an interactive talk and not so much of a formal lecture style. But I really want to talk a little bit about integrative approaches for life during and after cancer treatment for survivors of ovarian cancer. So I guess I'm wondering, first of all, who knows what integrative approaches or integrative health or integrative medicine means? I don't necessarily need a definition. I'm just wondering the show of hands who's heard of that term and understands what it is. So I'm guessing that the rest of you, it's probably new to you, right? So there's always that balance of some people are very familiar and some people are not so much. So I want to try to get through just a couple of brief definitions just to make sure we're all on the same page and understanding what we're talking about. So the origins of integrative medicine and integrative health really started in this sort of sense of alternative medicine, right? Things you do out of the mainstream that are kind of against or without conventional medicine, right? So maybe faith healing and giving up curative approaches to things, or a non-Western medical system. Maybe, there are definitely out there, I'm sure you've all seen these, claims that a certain dietary intervention will cure your cancer or can cure disease. So people do look for these things, and they are out there. But what we're talking about is more of a complementary approach, which is when there's a non-mainstream therapy that really does work well together with conventional medicine. So we're not really about giving up curative treatment or conventional treatment, not taking medications, not having surgeries, but really to help kind of overlay and using things like yoga to help manage your stress while you're dealing with a challenging medical diagnosis. Maybe a medically supervised dietary therapy, so like the Dean Ornish plan is a really great example of this for heart disease, which is originally kind of alternative-ish, and now it's fully integrated into the mainstream. Massage, if you're having low back pain after you've been evaluated by your doctor, not like going to your massage therapist and saying my back hurts and sort of letting them do their thing without kind of knowing what the cause is. So that's really a complementary approach. And so when we say integrative, what we mean is bringing these kinds of treatments into your care with the treatments that are being provided by your doctors, nurses, social workers, dietitians. So really, the main difference is both where the care is provided and the communication level between the different kinds of providers. So for example, at NYU, where I recently was working at the Cancer Center there with Dr. Blank and others, and also at Memorial Sloan Kettering, where I am now, we have integrative programs. So that means that when you see a provider who is practicing an integrative therapy, it's going to go in your record, your doctor's going to know about it, your doctor will be part of that treatment plan. So that's really what we mean, is it's really part of the mainstream care. So is that clear to everybody? Does anybody have any questions about that in particular, understanding the differences? Okay. So in cancer care, there are definitely some specific examples that I can give you. There are some doctors who specialize in integrative medicine, so you might go see one for a consult. We have several at Memorial who can really advise you on the best approaches for managing your symptoms kind of during and after treatment. Or maybe your oncologist refers you to an acupuncturist for hot flashes or some other side effect from treatment. Maybe your nurse is giving you education on sleep hygiene so that you can learn behavioral approaches to managing your sleep during chemotherapy, maybe alongside of or instead of taking a sedative medication. If you have a lymphatic congestion and you've been through physical therapy, you might go for a lymphatic massage ongoing to kind of manage you and help you kind of self-regulate after your PT's over, because as we all know, something like physical therapy is a defined benefit and has a beginning and an end, and sometimes you need ongoing care. So that's where sometimes, an integrative approach can be an extra layer. It is usually paying out of pocket, but it's less expensive maybe than paying out of pocket for PT. Or maybe at your cancer center there is a yoga class or a meditation class or Tai Chi, things that are offered there that are really tailored for you as somebody going through treatment. It's also or after treatment, it's also a nice way to build community, to have a yoga class where people can come at their cancer center and not feel maybe that they don't want to be in a mainstream cancer yoga class. That's what we hear a lot is, I don't really want to go to a yoga studio right now. I want to be around other people who are going through what I'm going through. So why does this matter? Obviously, first and foremost, stress is a really big issue, right? Fundamentally, but it's not necessarily something that can be treated by your doctor. Your doctor is treating your disease, and that's really important. How do you manage your stress is really for those of us whose jobs it is to help you with that. There are also some really persistent side effects from treatment that can last for years. We can help with integrative approaches with those kinds of things. Managing pain, acute or chronic pain, or maybe even pain that's unrelated to your cancer, but maybe you have a pre-existing condition or an orthopedic condition or something that's being exacerbated by the stress in your life. But finally, I think this idea that you can be empowered by really participating in your own care and in your own recovery by seeking out this kind of care and by bringing it back to your doctor and really opening up conversations is a really important aspect of an integrative approach to managing your health. So I want to talk a little bit about the nervous system. You guys familiar with how the nervous system works? There's basically two settings, right? And this is evolutionary biology. This is how we are wired from back when we were running away from wild animals and having to forage for our food, right? So we have this one setting that's kind of colloquially thought of as fight or flight, right? It's the sympathetic nervous system. It's where you are in danger. And so your body floods with all kinds of stress hormones. Your heart rate gets fast. Your breathing is pretty shallow and not full. Your digestion really suffers when you're in this fight or flight mode. You may be nauseated, you may have diarrhea, you may be constipated, you might have bladder issues, your thoughts can race, so it'll be hard to sleep. So has anybody ever not felt this? Right. So this is natural. This is your nervous system. This is designed to help us survive. We need this nervous system. We need this in order to do things like, battle cancer, which takes a lot of resources. We need it in order to sometimes just deal with challenges in life that are totally unrelated to cancer. So this is not a bad thing. It's just a natural nervous system response. The other side of the nervous system, the parasympathetic nervous system, is really that thing that we call rest and digest. So it's different kinds of biochemicals in your brain and in your body kind of helping your system to let go of that tightness of the muscles, helping to slow down your heart, helping you really take full breaths, helping your digestion regulate, calming your thoughts. So the challenge is always in finding the best balance between the necessary stress response to get through life, and then the restful stress response to continue to strengthen and heal and rebuild. So really what we want to do for you when we are integrative health practitioners and people who believe in this is help your nervous system shift gears. So how might we do that? So me personally, I'm a massage therapist. So anybody who's ever had a massage, do you ever feel like fight or flight after you had a massage? Ever? And if you do, you need a new massage therapist because they are really bad. Right, you get into this beautiful, blissful state when you have a massage. That's why I actually went to massage school, because I had a massage and I was like, I have never felt this way before, and I want to learn how to do this for people. It was completely that experience for me. So that's one really great way to just reset your nervous system, help you get into a better balance, help you heal. Another great way is through a meditative practice of breathing. So learning really kind of focused breaths, maybe a visualization, maybe what everybody's probably heard of nowadays, it's pretty trendy, but for good reasons, mindfulness practice, where you're really paying attention to your breath and to your environment, a yoga class, but even a walk in the park, a book, a ritual, going to church, having a meal with a friend, having a glass of wine, a cup of tea. These are actually, getting into this nervous system, this positive sort of relaxing nervous system response doesn't always depend on a an integrative health professional kind of getting you there. But what we can do is kind of coach you and help remind you of the necessity to be there and kind of encourage you to develop these healthy rituals and habits to treat yourself well and help your nervous system rebalance itself. So in terms of side effects, and I'm going to talk a little bit about some of the modalities that can really help with these side effects. Fatigue is a very, I'm sure you all know this, I'm not telling you anything you don't know, but it's known by everyone to be a really big problem that persists well after cancer treatment is over. So the best thing we know actually for fatigue, that's the evidence shows us, is exercise. So really, exercise is a non-pharmacological, lifestyle-based intervention that, some integrative programs actually really engage in an exercise kind of training and prescriptions and really advocate for that, because it's not only the best way to fight fatigue, but it's also one of the best ways to prevent cancer recurrence is by being physically active. So, but there are other things that we can do for fatigue. Paradoxically, massage has actually been shown to help with fatigue. I've seen, in my work situation, I've seen somebody get off a massage table. I can't take the credit because I was not the therapist, but she came out of the room and said, I feel so great. I'm going to go shopping now. And I was like, don't you want to go to bed? She's just felt so rejuvenated by having rested for that hour that she had all this energy. I mean, it was really amazing. For sleep, we can really advocate for mindful breathing. We're studying now yoga for sleep in the context of cancer, meditation for sleep, things that, what's actually not really, there's not enough evidence to show is good for sleep disturbance in people in general, but also in people with cancer. Guess what's really not shown to have benefit? Sedatives, right? When you do the research, you look at the National Sleep Foundation, you look at the Oncology Nursing Society evidence-based recommendations. Sedatives are actually, especially because of long-term persistent sleep problems. If you can't sleep and your doctor gives you a sedative and it helps you for like 1 or 2 nights, I'm not saying don't do that. And I want to be clear, I'm not giving medical advice and I'm not telling anybody not to or to do anything. But it's really interesting when you look at the evidence and see that the first line of treatment for sleep problems is almost always a sedative, because that's really what doctors know and that's their expertise. But there's so much more for chronic sleep problems that really need to be more behavioral and things that you can participate in and do for yourself. It's really often a self-care issue. Now, there are medical reasons why people can't sleep. I did a sleep talk for people, a prostate cancer survivors group, and they were getting up in the middle of the night because they had to pee. There's physiological problems that keep people awake. So, I'm not making a claim that if you meditate, you're not going to have to get up and pee in the middle of the night if you've had some kind of surgery that's making you do that. But for the most part, for sleep disorders that are really especially connected with stress and anxiety and worry, depression, these are all things that these other modalities can really support you in and help you to sleep better. Because it's all goes back to resetting the nervous system. If your nervous system is wired up, you're not going to sleep. And trust me, I know this from personal experience. And then when we have depression, anxiety, sometimes along with conventional treatment, we like to add something like, again, a mindfulness kind of cognitive therapy or yoga, maybe regular massage or acupuncture, things that can really help the nervous system bolster you and make you feel better sort of biochemically, because a lot of times there's stuff going on in your brain that medication can be really helpful with depression and anxiety, but you can get they say potentiating in the medical field, so the regular treatments that you're having can be enhanced by adding something that's really healing and nurturing to your conventional treatment for something like depression or anxiety. For digestion, in addition to the nervous system kind of reset, we really like to have people try acupuncture. Acupuncture is a thousands of years old form of traditional Chinese medicine, and in Western terms, we don't really understand exactly completely the mechanism of how and why it works. But for sort of systemic issues like digestive issues, it's considered in Chinese medicine to basically be an imbalance of your natural, sort of energies. And so what they're trying to do is bring you back to balance. In Western terms, this is called homeostasis, right? It's your body's natural regulatory system. So it's really not totally foreign. It's just using different language. But digestion can be really, really helped by acupuncture, and I really encourage you, if you're having digestive issues, to consider it if you haven't. Pelvic floor dysfunction. So in addition to physical therapy, which is probably recommended most of the time by your surgeon or by your doctor, a pelvic floor yoga class can really help you train your pelvic floor muscles, release when necessary, and develop that strength that you need to get back, some kind of function in that area, whether it's for, sexual function, for bladder function, whatever is going on with you, adding a pelvic floor yoga class can really, really help. And then hot flashes, I mentioned this in an earlier slide, but acupuncture, there's actually evidence that's come out that acupuncture can treat hot flashes that are related to cancer treatment. So if you've had, surgery that's impacted your endocrine system, and you're in early menopause, then acupuncture might be something that can really help you. And it doesn't necessarily have to be like a lifetime. You can, the way that it works is it sort of gets you re-regulated, and then you can kind of taper off. We've seen that a lot. When I was at NYU, we saw that a lot. I know we see that a lot at Memorial also, that people come and have acupuncture treatment for hot flashes. So pardon me while I sip my iced coffee. So in terms of pain, I really want to talk a little bit about pain control, because pain is such a serious and persistent problem. And so in a post-surgical pain situation, a lot of times, well, I will say in certain areas of the world, in particular in China and other parts of Asia, acupuncture is actually sometimes used as anesthesia during surgery. So it's pretty powerful medicine. So when someone's suffering from post-surgical pain that's really not responding well, or there are people who really choose, for whatever reasons, they don't want to take opioids, they really don't want to take a lot of pain medications, and then their doctor is wondering what to do to help them, we always hope that they will advocate to have them come for something like acupuncture that might really help with the pain. But also, when a post-surgical pain is kind of like musculoskeletal in nature, maybe you had a weird positioning, or like in radiation treatment also for breast cancer, people are in these weird positions where their neck is all contorted. So you get these musculoskeletal problems. So massage can really help with post-treatment pain that kind of lingers because your body's kind of done all kinds of weird things, whether it's in surgery or in other treatments. And then, like I said before, we all come to whatever health crisis we're in with all kinds of things that we had before. So if you're somebody who holds chronic musculoskeletal tension, and then you add a cancer diagnosis and treatment to that, you're going to still have that musculoskeletal tension. So you probably want to treat that with something that can really help you, like massage, yoga, stretching, breathing techniques. And then I think the last but really overlooked thing is what I'm calling, somatized emotional distress. So emotional trauma really can live in the body. You probably all have experienced this in some way or another, whether you get a tension headache, whether you just have abdominal cramping, tightness in your back, jaw tightness, whatever it is, that however it manifests for you, its origin can be emotional. So if it's treated with something that is a kind of loving and healing modality, that can really help you on the road to recovering from that particular kind of pain. Maybe in addition to psychotherapy and counseling, because you also want to be able to identify the source of that pain and to process it. But by adding a body work modality to that kind of a treatment, you can really start addressing those physical manifestations of emotional pain that are just so hard to treat otherwise. So I want to end on the empowerment note because, you guys, by virtue of being here, you're an empowerment crowd. You're here to learn, you're here to take control of your health care. I really want to just acknowledge that and applaud you for that. And when you look for treatments and talk to your doctor about therapies that will also help you that may not be conventional, that's kind of bucking the system a little bit. I mean, that's empowering. That's really saying, I want to think about things a little bit differently. I want to learn how to take care of myself. I want to be nurtured, and what wonderful things will happen to my body when that happens. I'll get these beautiful endorphins and I'll feel great. Feeling safe and cared for, I mean, that is so important, especially, as someone's completing treatment or maybe facing a recurrence or just going through something that's just so stressful for them, for their loved ones. So having a safe place to come to get nurtured and cared for is just so important, and I really encourage you to allow yourself to have that and find that, make that a priority. But last and not least is the simple fact of pleasure. Something can feel good and should feel good for you, for all of us. We should all have those moments of saying, I'm just going to do something because it feels good, and it's actually not bad for me. I'm not, again, advocating things that feel good that may be harmful, but something that feels good and is good for me, every single one of you has earned that right to have pleasure and have those moments where you're just enjoying whatever sensations are happening and whatever things are happening. So I just want to really end on that note of just encouraging you and thanking you so much for being here. And I'm looking forward to the panel and your questions. Thank you.